I'm David Mason, the Director of Public Health for the town of Sandwich, and today I'm sitting with Pam Gould, who is the Superintendent of the Sandwich School District. And how you been, Pam?
Oh, just good.
Yeah.
It's been a little bit of a crazy beginning of the school year, but we're doing all right.
I imagine.
We got the kids back in school. That's the most important thing.
Right, and we're 3 weeks in now?
This is our third week. We started before Labor Day. We're a short week, and then last week was the short week. So this is our first full week, as we say. So we're easing our way into it. So.
Very good.
But it is. We're into the routines, without a doubt.
So I think the purpose of today, what we want to talk about, Pam, is just, I know I'm receiving emails. I know you're receiving emails, yep. Calls, and
sure.
As far as there's a lot of questions about the protocols associated with the operation of the school day
sure.
and COVID, and what those COVID protocols are, the implications of them, and really, what I want to kind of really narrow down to is where they're coming from.
Sure.
And I think as far as what I've seen, and I know you've seen, is that there's been some energy. Energy from parents in the community directed at yourself, your staff,
sure.
Myself, as far as why are these protocols in place, and I can appreciate frustration, but
absolutely.
I guess it's a matter of how to where that frustration is being directed when you have no control of it.
Exactly.
And so I guess, I think the biggest thing is out there right now is and we can walk through it, is when your student is missing days at school, yep. Because of the COVID protocols, and as far as being a direct contact and the timing and what that means, and but let's back up a little, because this school year is different from last school year. So last school year was, you want to just give a kind of a brief synopsis of that?
And I think that's where people are seeing such the big difference, Dave. There were a number of communities. I'm not going to say Sandwich was better than everybody else. We weren't. But one of the things that we were able to do last year that other communities weren't able to do was we used a lot of our federal stimulus money, the ESSER money that we got, to purchase new staff. We made the decision that it was more important to have as many of our kids into the buildings that wanted to be in as possible, most especially at the elementary level. That was a huge priority for us. We wanted parents to have confidence that if they wanted their kid or had to have their kid in the building, that they were going to be consistently in the building.
Safely.
And safely. And so that was a huge priority for us. And so what we were able to do is purchase extra staff. I won't go into all the details, it'll take too long. But the reality, what that allowed us to do in the classroom and in the lunchrooms, was keep kids 6 feet apart. And so the protocols themselves haven't changed. But what happens is the ability for us to react to them. So last year that was that. At the secondary, we had a hybrid. We just could not figure out a way to get all those kids in. Most high schools, secondaries could not do that. But that still allowed us that 6 feet. So when we talk about last year, quarantining and sending kids home, except for if the kid was positive, this is a general statement, except for if the kid was positive, we didn't really send anybody home. We didn't have to.
Right.
Because the exposure within 6 feet never really happened.
Right, because you had all those controls in place.
We had all the controls
and the separation
in place. Right.
and the additional staff to spread people out more.
Exactly. So now we go to this year. We all wanted kids all back in school. Everyone did.
I'm going to interrupt you for a second.
Yes.
So last year's school year, in terms of those protocols, who what entity put those protocols in place?
Our administrative team. That was our summer last summer.
Okay.
The entire summer.
And where did those protocols come from?
So the protocols of quarantining and all that come from the Department of Education via Mass Department of Public Health, via CDC and all the entities. It flows down as it does. So when we get this from the Department of Education, we are required to follow what they send us. And that is important.
So any protocols in the school system, really, that come down from the Department of Education, you're required to follow.
Required to follow.
Much like, because they determine the educational frameworks that you have, and you're required to follow those.
We have to follow that.
So the COVID protocols are then passed down from the Department of Education, which you're expected to adhere to.
Right.
Okay, I'm sorry to
interrupt.
No, that's
okay. Thank you for pointing it out. So now we go into this year. We all left in June, skipping out of school because things were fantastic. We all knew that. We did not expect Delta. And that was a game changer, because then what would happen was, as we were starting to see that, and especially on the Cape, see that happen, we were all getting a little nervous. There was then a lot from, I will speak from the superintendent school committee side, a lot of confusion as we left in June from the commissioner saying all bets were off now, we're good, to this is not so good and where are we going? And we all saw, and talking with you and our COVID team all the time, the writing on the wall wasn't good. So the commissioner finally came out to try to alleviate some of this amongst a lot of towns and communities that were doing a lot of fighting, to be quite honest, of what was supposed to happen and not happen. So an edict came out via Mass Department of Public Health and the Department of Education that the protocols, again, still the same, but here's what we're doing, all masks on kids. It still got us all back into the building. That was huge. But here's now where it's different. All the kids are back in the buildings. We don't have the ability to keep the children at 6 feet all the time. It was always 3 to 6 feet, always. But the protocol for quarantining is 6 feet. So we went with that last year. That was our decision to say we want to do the 6 feet so that there's an assurance that people will be able to stay in. We can't do that this year. So while the protocols are still 3 to 6 feet, when the student, this mostly happens in the lunchroom because you take off your mask, when the student is unmasked or staff unmasked in an area that's less than 6 feet and you are deemed a close contact, we now have to quarantine. It stinks. This is awful. Our nursing staff has already been to the walls of how much they've had to work just starting the school year on top of their normal job of starting the school year with medicines and all that kind of stuff. But that's been a little bit of the, and of course, families were vacationing. Like we bring in people that have been not in school for 2 months and where they've been, and that's understandable. We knew that was going to happen. We're settling into it now, but that is the reality that we're dealing with, that the lunchroom is posing that because we can't keep kids 6 feet apart.
Okay.
But we want them all in the building, so it's a trade-off right now.
Right, because there's a couple things going on there too, as far as, after you finish the school year, under the protocols for last year, and I think you did a fabulous job, and your staff did last year. It was easy to work with you all, and because you maintained those, so it minimized the amount of effort and time being put in on contact tracing.
Yes.
A few instances with the
there
buses.
were, 100%.
There was those things, but not to the not to the level we're seeing at the beginning of the school year right now.
Right.
But going into this school year, after we ended this school year, you're correct in saying Delta was the variant thrown at us, and at the same time, a variable in there was the vaccination of 12 years and older.
Yep.
So that added a different dynamic, a good dynamic, but
fantastic.
At the same time, an interpretation of protocols. It added a little difference there, because I've been out speaking to businesses about it because everyone's, like, oh, what do we do with the vaccination people now? And how's that work? So there's some explanation going on there. And at the same time, through the summer, I'll throw Department of Education under the bus as far as time marched on through the summer. I'm aware, everyone was like, well, what's going on with the schools? As the summer passed, time passed, we're going to be masking. What are we going to do? And the general public or parents were asking that question. What it came right down to is we didn't know.
Yes.
Because that determination wasn't to be made by the Board of Health, myself, by you.
Right.
It was waiting for that overseeing entity, the Department of Education, that waiting for their protocol.
Were they going to give us any?
What was going to be provided at that point? So a lot of answers couldn't be given, and I believe initially there was a level of protocol put out, a guidance put out, and that was in place for a bit. That was kind of, self-explanatory if you read it a few times, but it really did push it towards a masking, because it was the unmasked, masking, testing, a number of options, but it all came down to a determination of, I think the intention of the Department of Education was to keep kids in school as many days as possible.
100%.
Because the remote learning doesn't exist anymore.
Correct. That is one thing. That's another thing that is changing. We can't do remote learning the way we did it last year.
And who took that away?
The Department of Education.
Okay, so it's not you, it's not anyone else that took it away.
It doesn't count on time on learning.
Right, so Department of Education, whereas that was an option last year, took away remote learning because it could not add to, to a child's educational hours.
Correct.
And we'll speak to that in a little bit, because I think that's a detriment to what's going on to a degree.
Yep.
And but at the same time, the first set of guidance that came out, I don't have a date on it, but had specific
August 13th.
August 13th, so Pam knows it well.
I know the date.
It's ingrained. And that was something you could take and then run with. And I know there was a lot of, all of a sudden as we got closer, there were people that were like, we don't want masking.
Yeah.
We don't want our kids masked in schools.
Right?
Okay,
Nobody
fine.
Does. None of us are
no
enjoying
one
this.
does. But at the same time, you're receiving a document
Yes.
from the Department of Education saying you have to do this.
Yes.
And I think it's, I just want people to understand that those determinations from the beginning into this period of time now isn't it being individually made, isn't being made in some back room at the school
No.
or in your office. It's basically a document being emailed to you saying this is how it's done.
Exactly.
So I think that's important for people to know, because there's a lot of energy being spent on their frustration, directing it at you, and I mentioned it before, at you, your staff, the nurses, and it's just unwarranted because, and I get the frustration,
We do.
but where the frustration is being directed is not useful.
Right.
You already have your hands full. So, really, as far as just one for education and two for what is going on, I'm sitting on the outside watching you and I'm hearing, what's occurring in the schools, and it's frustrating for me because it's, I know what you have to adhere to. I know where it's coming from. Why do we need to deal with these people that, to direct that level of energy? It's like, I think basically what I'm coming to the point is, you need to use your energy in a better way for those people that are frustrated. I will say that, as far as, to take it off of you, the school, yourself, the school, and your staff at this point. But so to understand some of those protocols also as we go walking in, there was an additional guidance given after the August 13th. Is that correct? For the entry, the 80%
Yes.
as far
All
as
right, sorry.
So there was a clarification given.
Exactly.
You want to speak
So
to
the
that?
clarification is
From the Department of
from the Department of
Education.
Education that we would do the full masking until October 1st, which I actually do agree with 100%, because I think, again, we talk about the families that have come from vacations and
Yep.
things. Getting us back into the routine of school is a good thing.
And it's like an in-house quarantine at that point.
Absolutely. So I'm 100% with that. So then the next part was after October 1st, there'll be some guidance coming out, but one of the things the commissioner talked about was using this barometer of 80% in a building vaccination status. So we certainly know right now under 12 years old that's not going to happen. But I think what he was leaving the opening of the door of was the secondary for us, our 7 to 12, STEM in high school.
Yep.
That they're all over 12. And so if we hit that 80%, now, we can question the 80% because that's the first time I had heard that in a sense. We had heard a lot of the herd immunity be 70 to 75. It's an argument we can have.
Right.
And I have actually put in I represent our Old Colony Superintendent's group, and I have put in a proposal that tweaked that a little bit. I don't know whether that'll go anywhere, but the idea being...
So you're tweaking on that. I mean, you're taking...
I'm offering a proposal, an alternative, because I agree with the 80% being onerous.
Right. So it's something that's a little
With
more
you, I mean,
workable.
we talked
right.
about it,
We had
yes.
talked about that. Yes.
And looking
that
at your
80%
town
is
rates.
a lot.
Yes, that is a lot.
So I mean, as far as we don't even have 80% in town, never mind
Exactly.
getting to
In
your
one building.
In one building. Right. So.
But
okay,
there is a path out of that, and that's what we're hoping. And so that's a piece of it. The other piece that came out, and we have now signed up and we'll be beginning Monday, is there are options for testing. The state is offering free opportunities for testing. You know that for our staff, for example, we've been sending all of our staff over to the fire station. That's great, and they've been amazing, but they're also getting tired of this too.
Right.
So the state offering the opportunity in our own district with our own nurses. So CIC Health is a group that they have partnered with, and there are 3 opportunities for testing. One that was in place last year, we didn't opt into it, and I'm still not leaning towards it, and in all of our groups that we've talked with, is the pool testing, where essentially they come into a classroom, as only the people that have volunteered to do it, and you take a pool sample, you see if, and you go through all of that. My contention there is if you don't have the majority of the classroom, it's really an artificial result.
It is. It is.
So that was part of our rationale last year.
Yep.
The second 2 are the ones that we are really opting into. One is the symptomatic, very simple. If a child walks down to the office, instead of having to make the child leave the school, have the parent pay for a test and do all of that, it's a first opportunity at a test for the child. Parent has to opt into it. We would never test without
So
that.
it does need parent approval and a sign off for
yes,
that.
I sent out on Sunday, I'll send it again, but another opportunity to do that. And then the second one is probably where the most important is right now for us, just based on what's happening, is what they call the test and stay. So the test and stay is, Dave Mason, you're in the cafeteria, say, and
Yep.
we have been determined that you are a close contact with patient X that was positive. You feel fine. You really don't, and your parent wants you to be in because we have no reason to believe that you're sick.
You're
We
trying to
want you
keep
the
them in
building.
school.
Yes.
Right.
So the test and stay would literally mean, again, the parent would have to have signed off on that already, is that for the five days of school, the weekend obviously is, but for 7 days, what we're doing is watching the symptoms. And so for 5 days that you're in school, you go down to the nurse, you start the day in the nurse's office, you do a quick, non-invasive, it's not the nasal all the way back, it's the 15-minute Abbott-Binax test. Each morning, you just test that out. You're negative, you go back to class. That's the important part. Because we know that generally, even when we're quarantining kids, most of the time they're going to be fine.
Right.
But we do need to watch it.
Right.
And so instead of having them have to sit at home, this allows them to stay in the building. And that's really all of our goals.
Okay, so let me play devil's
Yes, please,
advocate
please.
here to get back to where this is coming
Yep.
from again, is the fact that, okay, because you are correct in terms of when we've looked at the direct contacts and actual turnover or spreading of virus, it's been minimal.
And in the house, usually in the house.
It's
is when we
usually
see it.
occurring, it's in the
Exactly.
house.
Understandable.
But in those situations, we basically identified in the school year last year that the spread was not occurring in the
Nope.
school.
Once we had one
Right.
situation.
And that as far as the, direct contacts, they weren't, it wasn't occurring. You
Correct.
weren't seeing the virus occur. So this testing is a good option.
Yes.
But, you're going to have someone say, well, if it's not occurring, why do you need to do this? Why do you have to test? Why?
Because the protocols are there that we have to send you home to quarantine, whether we like it or not.
Because that's being
Right.
issued to you by the Department of Education.
right.
So again, just following the level of protocols. But I mean, to get back to that then, so a parent would have to opt into that situation for the 5-day testing.
Correct.
The 5-day testing is really a modification of the get out of jail. I always refer to it as the get out of jail free card.
Yep.
If you were a direct contact, quarantine,
Yep.
day 5 you test, you sit for 2
Exactly.
days, day 8 you're out.
Yep.
If you have no symptoms and you're negative. So this is a variation of that,
Yep.
allowing the child to stay in school, because that's the intent,
Right.
and that's
it's
what you
free
want.
testing for the parents.
Right. So at that point, so parents would have to opt into that.
Correct. So they have been sent a link, and again, I will do it again, but they have been sent a link to opt in. The link is directly to the CIC Health. The only one that sees the information of who's opted in or not is our nurses. The nurses are conducting the test. They're licensed nurses. I'm not conducting a test. And they report it into the state as a negative test.
Okay, and the intention of that is from a public health perspective, hey, keep you in,
Yep.
but if all of a sudden you're showing
pop,
something, you
then
pop,
you're
we're pulling you, so we're
Correct.
not creating more direct
Exactly,
contacts.
exactly.
We're not impacting additional students
Correct.
to limit the number of kids being removed.
Now, we keep them in the building. That what we do still have to do, because they are considered a close contact, is, for example, in the lunchroom, we still have to make every effort to keep them 6 feet away from other students. And that's for a short period of time.
Right.
But you can't go sit back with the lunchroom with your buddy and just sit right next, because you're still considered a close contact.
Okay, so
we
let's-
hope you're going to stay negative.
Let's bring up what I anticipate with that.
Yeah.
You're segregating my
Right.
child.
I think it's worse to be sent home.
There's choices that are being made here. There's options. There's not a we can't add options
Right.
because the options are coming from the Department of Education.
Right.
So it's not like you can make up rules as you go.
No.
Okay, so just like there is the peanut-free table,
Yep.
let's say,
Yep.
that you are
Right.
you'd have to have your child separated by 6 feet, masked the entire time,
Well,
other
except
than
for
when
when
eating.
you're actually eating, right?
Other
In the,
than
in
eating.
the classroom, you're okay because you are masked.
Right.
Right? So that actually can be normal. It's really just the cafeteria. When you're unmasked, we
Yep.
need to make sure so that just in case,
Right.
God forbid that you do become positive, that you haven't then created more close contacts.
Yep.
That's the whole goal.
So create that social distancing to ensure that it isn't a problem, but at the
Correct.
same time, you're able to keep
Correct.
them in school at that point. So, I mean, that's a great alternative, great
Yeah,
option
I
as far
hope
as
so.
for those that, don't want their child bumped out because
And
they're
none
in
of us
direct
do.
contact, and
Yep.
no one does. That's not the intent, but, following the protocols, that's sent down by the Department of Education. You're going to hear me say that many times, that, that's where all of this is coming from.
Right.
And, and it doesn't matter what I think about it, what
Nope.
you think about it, or what anybody thinks about it. That's what
Every
the
school
rules are.
district in Massachusetts is doing this right now.
Adhering to the rules.
Yep.
And so it's just what has to be done. And I think, so there's better ways to spend your energy on going after something that you can't change,
Right.
unless you go to the State House
Let's
yourself
work
and
together.
change it.
We do want kids in the building.
Right.
We 100% want kids in the building.
And that's why I say you did a great job last year in that effort, and I know that's the intention this year, because
Yeah. Yes.
I mean, you're proud of what you're doing as far as, at the same time as a district, you don't want to have your district bumping people out. I
No.
mean, you want it to be a showpiece of how it can be
Exactly.
done, but it takes cooperation of everyone in the community to do that
right.
at that point. So as far as then moving forward in this school year, I know that, with the Department of Education protocols, and then where do we stand? Do you have any information on that 80%? Because I know you took proactive measures to kind of make that a little more reasonable.
Yep.
Where does that stand right now?
So I have sent it off to our Executive Director of Mass Association of School Superintendents, who meets frequently with the commissioner. The commissioner has received that. I don't believe I'm not brilliant. I'm not the only one that has created some things like that. Ours was twofold. It was a little bit around that 80% and maybe lessening that a little bit, but also around your case count in your community, in your town, because I think that in working with you especially is, and you have guided us on that. If you're at 1.5% or lower, 2,
Right.
there's benchmarks to be able to do. Right now, Sandwich is not in a great place. We
Right.
know that.
We're
We're
well
heading in the
above
wrong
5%.
direction.
Right, as of today.
As of today, and so that's not a good thing. And so we do need to get that back, and I do think we will get it down once again. We're all back in our routines again. We're out of our summer vacations. All of our visitors have left the Cape. That's a good thing.
Right.
And so when you can get it into that place that it's a reasonable, maybe more people could take off a mask, right?
Yep.
If you're at such a low incidence rate that it's negligible in town, why shouldn't you be able to take off a mask? That I agree with people 100%.
Right.
And not just the vaccinated.
Exactly.
So-
And I think, in terms of that, that 5%, that's my
Yeah,
biggest
you use that.
frustration at this point, as far as what I use for guidance, and as far as the ability to control things beyond that, it really comes down to testing, masking, vaccination.
Yep.
And so, as far as where we're at as a community, the sooner we realize that, the sooner we can move on and make it a better school year.
That's what our goal is. We
For
want the
everyone.
kids in. We're playing sports. We're doing all of our clubs and activities. We're doing everything normal. That is awesome.
All right.
But I don't want kids missing out intermittently. I really don't,
Nope.
because if you're on a soccer team, you want to be playing soccer every day.
Exactly.
You don't want to be sent home for 5 days.
And the kids don't, as far as they want to be in, but
Yes.
again, as far as following these protocols, it's just what you need to adhere to at this time.
Exactly.
There's steps that can be taken to improve it.
Yep.
Parents just have to sign on to that
Yes.
also,
Yes.
in terms of within those guidelines.
Correct.
And again, if you're not happy with the guidelines, the best thing to do is reach out to your state rep to have that level of discussion. Let me ask you, as far as with all this going on too, if remote learning were a component, I mean, it's a challenge,
Mm-hmm.
but let's say if it was an allowed component, is that viable? Is that?
We would need more staffing, like we
Yep.
did last year a little bit. It certainly could be doable. There are some students that did thrive at home. There are some students that are still home right now because of all the medical stuff. They have medical issues and they can't come in.
Right.
They're doing what they've either done is homeschool, which we would prefer that parent doesn't have to do that, or they're doing some virtual schooling.
Okay.
But we have that right now. There
Yep.
are kids not in our buildings because
Right.
they physically can't be.
Cannot do it.
And that saddens us too, but we're just there in a public health emergency right now still.
And that remote learning is not an option that you have
Correct.
to put in
Right
place.
now.
I mean, that comes down from the state,
Correct.
the department also. So, that's, if there's things you want to work on that the public does not like within the protocols, they really need to reach out to their state rep or higher at that point to share, and not
I
share
can
your
listen, I just
not
can't do anything about it.
Yeah, exactly. Not share your frustration with the state,
Yeah.
but share a solution
Yes.
or an idea.
Yeah.
Because calling up to complain to the schools and the school staff isn't helping, and it's not going to change anything because, again, it comes down from the Department of Education. So I think we've kind of covered what the Department of Education
Thanks for having
covers.
me. I appreciate it.
Well, no,
I usually get to watch you and JJ do this, so this is.
But I think, again, I felt it was important, as far as people need to understand and be educated on where all of this is coming from. And a lot of times we just gloss over it because
we're so used to it.
We're so used to it,
know.
and it's what we know, that it needs to be shared. So again, thank you.
Thank
Pam,
you.
You're doing a great job.
Thank
Your
you.
staff is doing a great job. And thank you for watching, and educate yourself as far as what's going on and where things are coming from. Be safe out there.
Thank you.